That's it. Got it. That's it. Got it.
Welcome to the office.
En su nombre, Jesus.
Yes.
How you doing, Jesus?
Pretty good, pretty good.
Welcome to the office.
Thank you.
How can I help you?
The reason I came today is for my lower back.
Okay.
It's been bothering me for about 2 months. It first started with tightness of the whole body, upper down to lower. And then around the 15th of that weekend, I wasn't able to walk properly. I wasn't able to twist, bend. I couldn't even lay down. It was hard for me to turn on my sides.
What happened 2 months ago?
I have no idea.
Just came out of nowhere.
It just came out of nowhere.
You've had back pain in the past, obviously.
Correct.
Okay.
And I've just dealt with it.
So let's talk about it.
So I've had 2 back surgeries in the past.
Back surgeries,
Lower,
meaning they put metal in there, or
no,
they just cleaned your disc?
They just cleaned the disc,
So
from my understanding.
They did discectomy?
Yes.
Okay, so discectomy is where they go in and they shave off some of the disc, saying that that's what's herniated and pinching the nerve.
Correct.
Right?
Correct.
And you had it when?
One of them was about 5 years ago, and the first one was about 15.
Symptoms were down your left or right side?
The one for 5 years ago, the symptoms were running down to my left leg.
To the toes?
Down to the
Ankle.
toes, correct.
To the toes.
And my leg was actually cramped up, like I couldn't straighten it out.
In contracture?
Correct.
So
Like it was just
contracted.
like, correct.
So it wasn't a spasm, it was
No,
contracting.
correct.
Okay, so they did the discectomy there, loosened up your contracture.
Correct.
Pain was better.
Yes.
Okay, now you're still getting the same pain though.
Correct. Now it's back for, I have no idea why.
All right. What about the before that?
Before that, I was involved in an accident, got rear-ended at a red light, and that caused I think it was the L4 to get herniated or something like that. It was on the nerve. So I had to get surgery because for that one, I was actually facing down. I couldn't even stand up straight.
So L4 was also a discectomy around 15 years ago from a car accident.
Correct.
This was not an accident 5 years ago. There was some sort of flare-up or something happened.
Correct.
Okay. And your older brother brought you in.
Correct. My older brother brought me in because I was telling him, I'm looking at possibly maybe even going to a 3rd back surgery. But he said before you do that, to take the pain away.
Okay.
Yeah, because I'm just looking at my options, but he told me that he recommended you first and go check you out. And I said, well, might as well do it because I don't want another surgery. So I said, well, let's go ahead and go for it. Doesn't hurt.
Okay, fair enough. I appreciate it. He's gonna love you or hate you today. Okay, so we have a few things to talk about, and that's your number 1 issue, right?
Yes, my lower back, that's my main concern as of right now.
Going down to your knee.
Correct.
On the left side.
Yes.
What about shoulders?
Shoulders,
knees,
my
ankles.
I know my ankles, my knees, my shoulder. I know I'm all messed up.
So we need to get you back in balance.
Yes. For my shoulders, my main concern regarding the shoulders might be from the neck. Because sometimes when I sneeze, when someone's around, you want to try to hold it in. I actually feel like my arms go numb, both of them, all the way. And then I can't even move them for a couple of seconds. And then I'm able to start moving them, but with pain. So I'm not sure if like a pinched nerve or something.
Okay, we'll take a look at it and I'll explain everything that's going on for you, okay? You're coming from high desert, so
Yes.
you just got to get to me.
Correct.
That's my job is okay. Your job is to get him here.
Correct.
And this case is unique. This is actually, it's unique for you, but it's common in the world, where we get a shooting pain down the leg, we do a non-weight bearing MRI, we see a slight bulge, and that bulge we correlate it because we look at a chart and say, oh, that nerve comes from there, so it must be that. And the reason you have this is that because of that bulge, and so we're going to need to do some sort of surgical intervention, right?
Okay.
And in certain cases, maybe, but in 20 years I'm doing this, I don't see that. If the disc is sequestered, like it's into the spinal canal, sure. Stenosis we see as inferiority in terms of a mechanical stenosis. In your scenario, what you're describing, right? You're describing the left side. So the first surgery you said was L4, L5, the second surgery was L5, S1. And I want to explain this. This is kind of important. And we have a lot of new followers now. That's why I want to explain it. It's in a lot of my older videos. but I want to explain it. I want you to understand it. Spine is weight bearing, right? Spine is weight bearing. And it is synchronous and contiguous. Everything is connected. Things that happen down below affect up above and vice versa. Now, follow my process. When we get a vertebrae stuck from whatever reason, trauma, life, this one gets stuck. It misaligns first. It gets stuck. It causes some sort of irritation at that joint. The joint or the disc swells. The disc swells, could pinch the nerve, causes muscle changes, ligament changes. Okay. Then 2, 3, 4 segments above become hypermobile to compensate for the stuck joint. There's a concept of intersegmental motion versus global motion. And I used to talk a lot about this, where let's say we say touch your toes. That's global motion of the whole spine. Each individual bone has to move a certain amount, and they have quantified that in one of the textbooks, White and Punjabi, Clinical Biomechanics of the Spine. So we already know how much flexion, extension, rotation, lateral bend is at every segment. Now, this one is stuck. These compensate, become hypermobile over time. You're using them more. They can wear out a little faster. But we have this irritation. We go and we take a non-weight bearing image. The stuck joint don't move. The hypermobile segments move, creating what we call false positives.
Got it.
20 years I'm doing this. I've seen thousands of false positives.
Got it.
I've seen a few positives. Okay. So looking at L4 and L5, I'm going to actually give you the answers lower down. That wasn't your answer. The answer was in the basement, in the tailbone. Okay? He probably told you that too. You told him, right? You told him. You're going to get cracking today. All right, jokes aside. Let's go over your x-rays.
Okay.
Let me explain now what I'm
Okay.
Let me show you what I'm explaining.
Okay.
Okay? Let's go over here and look at your x-rays. This is you, Jesus. This is a picture in time. Tells us how you've evolved from birth. We're looking at full spine x-rays. This is your AP, this is your lateral. Think of this as your 24-story building. This is the foundation of your 24-story building. In order to have a stable building, you need a level base and foundation. What you're telling me is you had surgery in the first and second floor, L4 and L5, right? Or L5 and L4.
Yeah.
But what I want to show you first is, do we have a level base? Is this level?
No.
No, it's not. And we're going to talk about this in a lot more detail and explain the consequence of what happens up above too, and why you're getting that stuff in your neck and arms too. Okay? Let's first talk about this x-ray though. On this x-ray we're looking at, this is your side profile. We're looking at, do we have the right curves? How do the discs look? And what's our posture? So the first question is our posture. And if we run the line up, this is a posture line. We're running it up from the base, the lowest lumbar, up to the base of the neck. This should go through C7, which yours does, but it should also go through C2. What it's showing us, you present with what's called anterior head carriage. Anterior head carriage, for every 1 degree past neutral, it's equivalent to the lower cervical spine feeling 10 pounds. So if we're 14.2, or let's just say 14 degrees forward, you're carrying 140 pounds on your shoulder. So you sit for 10, 20, 30 minutes, you start to feel it, I'm pretty sure. Okay? That's number one. Posture is not the cause, it's contributory. We're going to get into why the posture is like that. Okay? So let's move this stuff out of the way now, and let's get over here. What do our curves look like? You have the reverse curve in the neck, it needs to go forward. You have a very straight spine, you don't have the curvature you need. And as a result of that, this has taken up all the shock. Okay? There's a video where I talk about spinal defense mechanisms, and we'll probably put a link to it for people to look at spinal defenses. Let's go over your low back and work our way up. I see staples. You had gallbladder surgery?
Yes.
Yeah? Okay. We need to talk about your digestion also. So let's look at your low back. And as your bro said, yes, this is a tailbone injury. You have a S5 coccyx that's out number 1. You have S1 that's swollen over here. I'm going to put it all together. I'm just pointing out things I see. This should be a smooth arc. You can see the bend right there. Or the kink, I should say. Right there.
Okay, yeah.
Okay? So we're going to need to deal with that. Now, they did your discectomy. The good news is you still have good disc there.
Good.
That's the good news. They didn't shave everything away. But here's what I want you to see. When I look at it, I see that, you see how we see these circle patterns?
Yes.
It's because they're not parallel. They're tilting. And if we look at the other x-ray, right, it's a slight tilt because of the short leg on the right side. Okay, follow the process. As we go up, your discs overall are great.
Nice.
So I'm happy with that. I'm happy with all that. The discs are fine. These discs are fine. Even in your neck, your discs are fine, but you're getting that reverse curve with the forward head posture, which is causing your neck and shoulder stuff. But all of that is secondary to the foundation.
Got it.
Okay? Does that make sense?
Yes.
Let's talk about this one now. Level base and foundation. So when we're looking at the foundation, the way the pelvis works, they work in opposite. One goes up, the other goes down. One goes in, the other goes out. You have a rotated sacrum on the left side, P2-L. It's dropped 1 millimeter on this side. There's the coccyx swollen right there we're going to work on first. Now, here's the challenge I need to figure out with you, okay? This is our challenge. When we see no curve in the spine, that usually comes from an ASIN or AS or IN ilium, which is there. However, if I work on your hips, I'm going to make your leg length worse. Right now, it's 5 millimeters lower on the right. Your right pelvis goes up. That means your left pelvis is down. And it goes out and in. So PIEXASIN. So the body is favoring to the right side when you walk with that little tilt on that right little gangster lean.
I feel it.
You got that little lean, right? You got that little holding onto his pants. I'm joking, dude. I'm joking, dude. I'm joking. Okay, but here's the thing. I'm going to talk about the left side because the sacrum is rotated on that side. So, sacrum goes back 2 millimeters, the pelvis goes down and out. The disconnect is there. Left side, left side. The issue you were talking about, again, goes back to sacrum, tailbone. Now, when we look at your tailbone here, I want you to see this. You can actually see the bend. Do you see that?
Yeah.
It bends like that. And that bend is part of why this is like this. Now, if I have to adjust the pelvis, I'll do it a couple of times. But I'm going to need to monitor. In your case, I will probably do a re-x-ray spot shot sooner than later because I would expect certain changes to happen. And I don't want to over-adjust something going. I need to work on your ASIN to give you a curve. If I do it too much, the hip drops more. So I got to figure out how can we get that down, but keep the curve. Does that make sense?
Yes.
Did that make sense? Did it?
It makes sense.
So, coccyx, sacrum. Now let's work our way up. All of this other stuff is compensation, right? It goes this way, comes back, goes this way. Then we got another nice kink here. We will talk later about your digestion, how you need to eat to balance, because when someone doesn't have a gallbladder, they should be having at least 4 or 5 small meals. The bile is produced in the liver. It's just a storage. So whatever you make, you need to use. But you eat this big fatty meal that you need to clear that fat with bile, you don't have the bile. So what happens? It goes in the poop, and your stool starts to float. You get what it's called steatorrhea, the floaty stools. It means there's a lot of fat content in there. Okay, let's work our way up. Upper cervical looks good. C2 is off just a tiny bit. All of this is compensation. We'll see what I find there. But all of this up top is compensating for this foundation. So my focus is We'll figure out your foundation today. Anything going on in the mid or base of the neck I'll work on. But this is not a digestion case. As I do a couple of adjustments, you just report back what's different.
Okay.
Sound good?
Yep.
All right. Shall we get started?
Sure.
Let's rock and roll. Walk to the corner of the room and back a few times, please. All right, keep walking. So he doesn't really go through his SI joints. He's very guarded in his walk. Keep walking, please. Are you getting that shooting pain right now?
No.
Just guarded in his walk, right? Has he been like this for a while? Have a seat. You sure you didn't mess with him as a kid? 'Cause it's gonna come out, dude. It's gonna come out today. I'm glad you're here. Oh, head down, please. Starting at the base of the neck. 15 points, C1, left side. T5. Ooh, that's liver gallbladder. T5, 5 points. Slow it down. Oh my God, guess what? It's not your L4, L5. S4, S5. Now, down low, S4, S5, Coccyx area, T5, and up top in the penthouse. Let's take a look here. Let's look at his overall presentation. This is your normal posture, and all this is inflammation. It's all inflammation. Static palpation, running my fingers down the spine. And right when we get there, we start to get the pooling edema. That's one of the things we're looking for in static palpation. Edema, point tenderness, redness. Tender right there? Or that one? You have a high pain threshold, don't you? That's the problem.
Yes.
And as soon as I touch him, he's doing this. So I need you not to do this, okay? Relax there. I'm not going to go hard. Head down. That's the one. Little sore. See, so as soon as he stopped contracting, he started to feel it. And a lot of it, guys, I see a lot of people in defense. In defense. Defense. Back slowly towards me, please. Numero 5. 5. Pain, tender. 4. Little tender there. 3. No. S1. Oh yeah.
Starting.
S2. Yes? S3. 4. I'm going down low. Right there, brother. See? Cool. Check him out. 5. 1. 1, 2, 3. Look at his face. 4 and 5. Face don't lie. 4, 5.
I felt it all up to here.
You felt it all the way up to there, right? That's the imbalance. And so the body has to compensate. T5, S4, S5, Coccyx, and upper cervical. Sit back for me, please. C1. Now, we're going to do C1.
Okay.
Then we're going to do down low.
Okay.
Then we're going to end in T5, have you walk. Then I'm going to tune up your feet, shoulders, and elbows, ankles, all that stuff. Okay?
Okay.
And wrist. After that, you go walk for half an hour before you take off.
Okay.
And then we'll see you for a few visits, and we'll decide from there what to do.
Okay.
Fair enough?
Fair enough.
Cool. Doo-doo. Wow. Wow, 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 wow. Drop it down, down. Nope. Wow, you're gonna make me work for that one. Come over here, let's go face down. You crack your neck a lot, don't you?
Yes.
And you get your neck twisted, right? Yes. Turn your head to the left. Slide up some more, please. Head in there, left hand here. Do me a favor, starting today, no self-cracking. That's the home run.
Nice.
Head down, please. You know what? I'm gonna just do T5 since we're here now, and then I'll switch it up. I'm gonna go 5. Drop. Nice.
When you did that one, I felt it on my lower back.
This middle one, right?
Yeah.
Walk it off, check it out. I haven't touched your back yet.
A little light-headed.
See how his walk is changing, bro?
Yeah.
I already feel it. I haven't touched your back yet. What's different?
I don't feel like I'm losing my balance.
Let's go left side down. Coccyx on this side, sacrum on the other. You don't have a lot of scribble in his story though, that's good. That's a good thing. Slide forward a little bit, bottom leg straight, top leg bent. Okay, I'm gonna be on your underwear, okay? I'm down low on the coccyx. Right. Easy. Relax there. Relax. Let it go. Let it roll. Oh, it so wants to go. That's a piece. Let's go to the other side, please. This side over here. And there are many ways to do the push-pull. Let it roll, let it roll. That's it. Nice. Come on up, sir. Walk it off once, and then we're going to go face down. You okay?
Yeah.
You're holding something needs to come out, dude. Face down, please. How many siblings you have?
There's 4 of us total.
All brothers?
One sister.
One sister. Slide up a little, sir. All right. There it is.
Oh.
I'm going to use the drop board. I need to be on the left side of the sacrum. There, and I need to torque up. Tone. If you're pressing on the patient and it's hurting them, use more fingertips. The fingertips creates more surface area. More surface area, less pain. I need you to bring that chin up. Ah, gotcha.
Yeah.
That's the home run, brother. Wait for it. Take your time. There's no rush. Hold my hand, please. Just come out. March in place. Look at me. It's deep. You're gonna be all right, okay?
Just like to lift my right leg and it doesn't affect that side.
That's right. Walk it out. Check it out. Check it out. I was being so nice today because your brother's here. Walk it out 3-4 times, and then we'll recheck. Tell us what's different, sir.
I feel like the balance is definitely better. And I don't feel like I'm walking with,
Can you look ahead instead of your feet, though? You just
no.
keep.
I
Why?
I'm just accustomed looking down.
Stop. Can we get in one of those cones like they put on those dogs?
I
dude?
try when I catch myself, but then it's like, just go right back into thinking mode.
Alright. Well, I'm gonna get to a button in your back during this process, and it's gonna hurt you to look down. I promise. I promise you. In fact, I'm gonna do it right now. Vamos. Boca abajo. You're walking like a 90-year-old man with arthritis. So, what's Dr. Rahim gonna do? He didn't scope! Oh my God, what is he gonna do? All the way down, brother. Poquito. Drop. There you go. How much weight did you lose over the years?
Before my first surgery, probably lost about close to 100 pounds maybe.
Look straight ahead. Straight ahead. You may want to get in one of those back braces temporarily. Not so tight, just to keep them upright, okay?
Mm-hmm.
Let's rescope. How is it?
I just feel a little like tightness on the, I'm assuming it's the piriformis.
Okay. Starting at the base. C1 is clear. You got a little heat, which should dissipate. That is clear. Sacrum is clear. Check it out. Back towards me. This is 5. You remember? That's 4. That's 5. That's 1.
When you do that, feel like a small
3.
on the back of the knee.
No problem. We're gonna get there. We're not there yet. We started it down low, right? S4. Mira,
But wait, yeah, it's different.
right?
Yeah.
I'm not gonna do this one. You're gonna walk in ice and it's gonna start to release as you walk. And if you wanna test it out, you're gonna go walk anyway, 15, 20 minutes, half hour. Check in before you go.
Okay.
Okay. Clear. Ears. Shoulders. Don't help. Don't help. Nice. On your back, please. Ba-da, ba-da. Raise the leg. Let's check the knee. Make sure there's no knee issue. You okay with that?
Yeah.
Where? Hip or knee?
And it's from the
Piriformis?
to the back of the knee.
Go face down then. Let's break up some scar tissue. Face down. On this side, please. So what I'm doing, he's had this for so long. This is a 15-year-old injury.
Oh.
Whoa, 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 whoa.
I can't leave. Oh.
Okay, all right, what's going on?
I try to leave like I just did. I feel the tightness from here down to the back of the knee.
Interesting. Okay, come up slowly, boss.
Get back up or
Yep, get back up. That's not good. We gotta figure out something else. Good test. Something I do. Back towards me, please. Let's try it again. 5 is good.
feels fine.
4 is good.
Yeah.
Okay. S1 goes to the knee. That goes to the knee.
Yeah. Yeah. Right there. Oh.
Let's do the leg check. Go face down. Oh, sorry, you can't go face down. Let's do it over.
Right.
No, let's do it over here, face down. I'll do it here. I gotta do a quick leg check and see. I may have to work on your pelvis. You're okay this way, right?
Yeah.
So it was going down in position. It wasn't actually the position. You see that?
It just feels slight tightness right here.
But not like over there, right?
Correct.
So going down in position was worse than actually in the position.
Correct.
Now, the test we're going to do is the Gonstead Leg Check. We're going to determine rotated sacrum or pelvis. We look at the hips here, or we look at the heels here. The left one is longer. We're going to bend the knees. If the left one stays longer, it's pelvis. What is it? Pelvis. You don't want to make my life easy. Actually, nobody does, so it's okay. Walk it off, please, and then I'm going to work on that hip. Okay. Let's go right side down over here, please. That was a first. I'm glad. Here's a first. Bottom leg straight, top leg bend. Okay, bring your ankle behind the knee, please. There you go. Slide forward. That's it, that's it. Go up on your shoulder though. There you go. Straighten this out. Tuck forward. That's it. You okay there? I'm gonna do it quick, all right? Quick. So we were just talking about the push-pull, and this is actually ideal in his case because we got to do it quick. We don't have quick. There's the pelvis. We're going to push it up and in. You okay, boss?
Yeah.
Can I roll you?
Yep.
Let it roll. Let it roll. Let it roll. So we need to push it up and in. That way. There you go. Gotcha. Take your time. Turn to your side, please. Push yourself up, swing your legs down. Okay. You'll go walk for 20 minutes, come back. Walk it off. A little easier?
That's a little easier.
Walk 2 more times. I gotta test it out. You gotta go back face down. You gotta see if there's any change. Hold on, let me close you up.
I'm already feeling it.
You already feeling
I'm
it?
already feeling it.
Alright, come over here. Last time. One more. Can you bear with me one more?
Yes,
I'm gonna go real quick, okay? Relax the right shoulder. That's it. Got it. That's it. Got it. What's that? I had to, brother. That's it. You go walk and I'll check you in 20-30 minutes, okay?
Okay.
Just to make sure. I won't have you drive off back to the desert like that. Okay. March in place. Raise your right and left leg up high. There you go. There you go. Okay. And ice pack, go walk, and I'll see you in 20-30 minutes.
Okay. Thank you.
Welcome to the office.